Okay, the first thing I would do is, or actually before I start, here's my card. Okay, so the first thing I would do is wash my hands and don gloves. Then I would introduce myself to the patient. Hello, my name is Kristen Buck. I am a nurse educating student and I will be doing your assessment today.
Okay.
Okay, so after this, we are going to start the inspection of the respiratory system. So for this assessment, we would normally have the shirt off, but because we are recording our stuff, we won't. Okay, so I'm gonna be touching your chest and everything, okay?
Okay.
All right, so first we're gonna look for respiratory distress. We're gonna look at rate, rhythm, and depth of respiratory rate. So his respiratory rate is 16. So then we're going to be looking at accessory muscles uses in the supraclavicular area right here and the neck. So no accessory muscle use there. Okay, so now we're going to be looking at, okay, so I'm going to be looking at the intercostal spaces for retractions. So again, I'm going to touch you. So feel for this right here and then go over. If you'll take your feet up, I'm going to spin you around, okay? All right, and then find this right here. Okay, so I do not feel any retractions. I do not notice any bruises, swelling, or anything like that. Now I'm going to turn you back around. So, can you stand up for just a second for me? Okay, so we're going to be looking at the anterior posterior diameter. So, there we go. Okay, so the lateral diameter is about half the size of the anterior posterior diameter, so it's right where it's supposed to be. All right, and you'll do me a favor. Deep breath. Okay, out. Okay, and deep breath. Out. Okay, so again, symmetrical. I'm not feeling any deformities. There's no retractions. There's the rate, the rhythm, the depth's all fine. You can sit back down. Okay. All right. So like I said, the chest wall symmetrical, and just overall, the inspection is good. Now we're going to do the percussion. So for the percussion, I will have the middle finger out and be tapping right here. All right. No other fingers will touch. Okay. You'll sit forward for me. Actually, let me rotate you around so I got this on camera. Okay. All right, let's turn you back around. So whenever I did the percussion, they resonated. So that was how it was supposed to be. And again, if there was any pain, is there any pain? Okay, so there's no pain, there's no bruising, there's no ulcers, there's nothing for me to palpate. But if I was, I'd be going down like this, and then doing the same on the back. Okay, so now we're going to move on to auscultation. So as I remember where it is. Okay. All right. So we're going to listen. Deep breath. Open your mouth and deep breathe for me. All right. Again. 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 And again. Okay. So the lung fields on the anterior part are clear. All right, then could you lean forward for me? No, I'm spinning again. Okay, so we're gonna listen here. Deep breath for me. And out. And in. 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 Out. And in. Out. And in. And out. And in. And out. And in. And out. Okay, so again, all the sounds are normal. You hear a bronchial sound right here and right here like you're supposed to, and then you hear a vertebral sound everywhere else. Let's see. Let me one more time. And the intensity of the breath sounds are how they're supposed to be. There wasn't, and the sound wasn't loud or too soft. There wasn't any dullness. There wasn't any areas where the sounds was missing. So now that we've done that, we're going to move, or before I do the cardiac exam, since we're going to have to move over to the bed, I'm going to do the other part of the cardiac exam, which is the legs and feet. So for the legs, we'll be looking here. We're going to look at color and with the inspection, and I'm going to be touching you, okay?
Okay.
All right, so we're going to be looking at color, temperature, bilaterally. Both legs are warm. There is a scar on the right leg that is from a knee surgery. And will you straighten this leg out for me? 10 centimeters. The veins and everything look evenly distributed. The hair on the upper parts is fully there, no patches, no issues like that. Starting about halfway down, or starting about the boot line on both sides, there is no hair. Let's see. There, can you stand up for me? Okay. So looking at both sides, I don't see any varicose veins. You can sit back down. Okay, the color is, he's not, and they're not pale, there's no redness, no issues like that noted. All right, I'm gonna mess with your feet real fast, okay?
Okay.
All right, so I'm checking the capillary refills. On the left foot, they are all less than 3 seconds. And on the right side, they are all less than 3 seconds. All right, can you pick your foot up for me? Okay, this one. Well, there's a rock there. Okay, no ulcerations noted, no openings noted, nothing like that. Let's see. Okay, so actually, all right, so now we'll move on to the inspection. In the inspection, I'm going to be feeling the arteries. So I'm going to get a little personal, okay?
Okay.
All right, so we'll feel the femoral artery on this side, and then a little bit on this side. We will fill up the popliteal arteries back here. We will fill up the dorsal pedis arteries. And we will fill up the posterior lateral arteries. Okay, every one of those was fine. I could feel them. They were equal bilaterally. Looking at the legs, there's no edema noted or anything like that, but okay. There's no swelling. Okay. Now, will you stand up one more time? All right, so again, getting a little personal.
Okay.
I'll be feeling right here for the superior no, nodes. I felt horizontal and vertical, and they are all good. There's no swelling noted in the nodules. You can sit back down. Okay, so again, before we move over, I want to talk about the breast exam. In the breast exam for a woman, you would be looking at color, size, symmetry. You'd be looking for retractions, discharge. You'd be looking at the areolas for their size, shape. You'd be looking for any rashes or anything like that. You would start the exam with their arms relaxed at their sides. Then you would move on to above their heads, at their hips, and then leaning forward. For men, again, you would do their exam and you'd be looking at the areolas to check the size, and you would be looking for any um, any enlargements, any ulcers, any nodules formed around the breast tissue as well. For the palpation part of the breast, for a woman, you would have the second, third, and fourth finger. You would do those across the breast in a either horizontal, circular, or vertical pattern, doing it slow and filling up every part of the breast for nodules. You would chart any sizes or shapes of nodules felt, and then you would also feel up the nipples for elasticity. For the men's part, you would be feeling of the breast tissue for nodules as well, but you would also be feeling for to see if there was fat enlargements or if there was some issues with the breast. Let's see. Now you would let's move on to the axillary before we go back to the cardiac exam. So if you could lift your arms above your heads for me. So for the first one, you'd be doing the central, and you're going to cup like this and feel for nodules. Cup, feel for nodules. Okay, none felt. So then I'll go lateral, lateral, and I do not feel any. Then you would have the axillary tissue and the like breast tissue, and you would pinch that and feel for any nodules in that. And again, you can put your arms down. Any nodules noted would be assessed, size charted. You're going to do the supraclavicular and I forgot to mention this earlier. He has a deformity on the right side from his being broken intraclavicular nodule. Okay, again, no nodules felt, no issues felt. All right, if you're ready, let's move you to the bed.
Okay.
Yes, sir. Okay, so to start this out, you would start by having him, again, lay at this 30-degree angle. Can you go up a little bit? Because that's not quite 30 degrees. Okay, so lay down and I'm going to inspect the carotid to look at the pulses. Can you turn your head this way? All right. I'm also going to be looking at the JVD and looking at it and inspecting it. Can you turn this way? Again, carotid, JVD, no issues noted. You can turn back. All right. Now I'm going to check the JVD. So one more time this way. So I would get this right here set up and find the JVD. And it's 2.5 centimeters. So that is within normal. I am going to fill up the carotid arteries. Again, you do this one at a time, and you fill a third of the way down. Can you, all right, fill this side. Okay, so carotid artery fills fine. All right, then I'm going to fill up the PMI over here. Let me get this out. And that is between the 5th and 4th intercostal, around the bra line in a woman. Can you turn just a little bit to your side? Because I can't feel it. Okay. And again, I feel that one is at 3 centimeters. You can turn back over. Okay, so now I'm going to be listening to the carotid for any bruises, and I did not feel any thrills whenever I felt it. So, hold your breath for me. All right, you can breathe. All right, hold your breath for me. Okay, no, you can breathe. No bruise heard. All right, so for the exam, I would have them normally at a 30-degree angle, but I'm gonna have you sit up so that I can make sure that you see the right, that I'm doing these in the right areas. So, listen right here. Aortic, pulmonary, iris point, mitral, or this is tricuspid actually. Mitral. Okay, so the heart has a regular rate and rhythm at 80 beats a minute. S1 and S2 sounds are heard as they are supposed to. No S3 sounds heard, no S4 sounds, and no murmurs heard. Thank you.